Good morning, and I thank you all for joining us today. I'm Edith Parker. I'm the Dean of the College of Public Health, and I am delighted to welcome you to the Richard and Barbara Hansen Distinguished Lecture. We are pleased that this year's Hansen Lecture also serves as a keynote address for the Health Equity Advancement Lab, also known as HEAL. And HEAL highlights current evidence-based health equity work being done at Iowa, here in the college, and furthers the mission of promoting health equity through community-engaged public health research and practice. It is our honor today to recognize Bernard J. Tyson as our college's Hansen Leadership Award recipient. The Hansen Award affords us the unique opportunity to honor individuals such as Mr. Tyson and other national leaders who have made sustained contributions in the area of public health, and to bring those individuals to the University of Iowa to interact with our students, faculty, staff, and the broader community. This annual award is made possible by a generous gift from Richard and Barbara Hansen of Iowa City. Although Dick and Barb are not available to be with us today, please join me in thanking them for their outstanding support of the college. Bernard J. Tyson is the chairman and CEO of Kaiser Permanente, one of America's leading integrated healthcare providers and not-for-profit health plans. Kaiser Permanente serves more than 12 million, actually I'm going to say 13 million, members in 8 states in the District of Columbia. Mr. Tyson assumed the role of chairman in January 2014 and has served as CEO since 2013. His career at Kaiser Permanente has spanned more than 34 years, and he has successfully managed all major aspects of the organization during this time, serving in roles from hospital administrator to division president to president and chief operating officer. Under Mr. Tyson's leadership, Kaiser Permanente continues to drive the need for affordable, accessible, high-quality health care and improving the health of its members and residents in its communities. Mr. Tyson has guided Kaiser Permanente in staking out a leadership role to advance population health by addressing social, economical, and environmental aspects of health. The health system is, I think, really leading the field in thinking about social determinants of health and is investing in programs to prevent and reduce homelessness, promote affordable housing, research focused on preventing gun-related injuries and deaths, and also activities to reduce healthcare disparities in the community it serves. And it is also pledged to go carbon neutral by 2020 to help combat climate change and foster a healthier environment. It is now my great pleasure to welcome Bernard J. Tyson and to present him with the 2018 Hansen Leadership Award. Bernard, congratulations, and we thank you for being here today.
Okay, I got the green light. Thank you so much. What an honor, and what a beautiful, beautiful award. It's really beautiful. Don't want to break it. I can't tell you how, can you hear me okay? I can't tell you how honored I am to be here with you on today and to spend this time with you. And I've gotten to know some of you from the earlier sessions, and I made the comment that this is the first time I've been to Iowa, so it's also a privilege to be here. When I was approached about coming and spending a day with you, day and a half, and the award, and started to look into the history and everything with the team, I can't tell you how excited I've been about coming today. And then when I heard that you had a special emphasis on equity and equality, I said, wow, this is a school that really gets it. And so for sure, I want to go and spend some time and learn and offer some thoughts. And I wanted to finally get a chance to see Iowa. So it's been like a field trip for me since I got off the plane, and I said, "Wow, this is the airport." And got on the road. Wow, this is the road. Then got wherever I was, man. Wow, this is the hotel. Is this the hotel? Yes, this is the hotel, sir. And went inside. It's a beautiful hotel, but a lot of plaid. I don't know if that's part of the culture of Iowa. And we went to a steakhouse for dinner last night, and only 2 people ordered steaks. So that's, I made it the evening without ordering them, 24-ounce porterhouse. But I thought about that steak all night. so I'll have to make up for it when I go to California. I will tell you though, I ordered the chicken, and they brought the chicken. It was almost a whole chicken. In California, it would have been like a leg, trimmed, with a little bit of gravy, and that would have been it. So it's been really great being here and spending the time with you. I'm not one that go to bed at night sad and depressed and down and not feeling hopeful and optimistic. I have too many indicators that suggest that's not a good way of looking at life and where we are and what's possible. So I went to bed last night feeling optimistic, and I woke up this morning feeling optimistic. I'm not blind to the reality that not everybody can say that. There are a lot of people who go to bed at night and they don't want to wake up in the morning. There are people who go to bed at night and they wonder if they can wake up in the morning. And one of the questions is, what's the difference? Why is it? Why is it that I walk around with a sense of optimism and my heritage goes back to slavery, and someone else comes from the land of plenty and privilege and they contemplate suicide? It's not an easy answer. And what I like about what you're going through is you're being educated to think beyond what today is the character of a couple of words that creates a narrative called a tweet that can send a discussion in one direction or the other. And I walk away today from your questions and the engagement optimistic that you are going to be part of the deeper thinking that's required to help to make this world and this country a better place. That's what I walk away with. So, you live, we live, I live in a time period where some people would call it the best of times and the worst of times. And I heard that over the last day and a half in the questions that you've asked. With the first group that I met with this morning, a sense of the things that you're going to advocate for. Your ability to relate to the world isn't equal for everyone. As I said this morning when we were talking upon reflection, I've always believed in equality of opportunity being the optimal state, but it doesn't mean that it's going to be equality of outcomes. That I want to know that there's a level playing field, that I have an opportunity to live out my American dream. It doesn't mean that my outcome is going to be the same as yours, but I want to wake up every day knowing I have at least a fighting chance, that the field is level enough that I feel like my energy is going towards my aspiration. As opposed to I wake up every day saying the field is against me and it's not level by any stretch of the imagination. And when I look at, for example, the distribution map of wealth over the last 20 years, where 10% has gotten over 100% of the wealth distribution, and the other 90% has gotten less than that, no one walking can tell me that the field was that level, and the 10% was where God gave all the wisdom and knowledge to, and the rest of the 90% just never got it. And you were asking those questions. I'm also extremely optimistic about the evolution of health and healthcare in this country. We're already spending a lot of money, so it's not a money issue. We've already committed that care is actually guaranteed in this country. We've already answered that question. Sometimes when I get in different debates, I would, say, well, let's keep score on things. Everybody right now have a right to care in this country. People have argued with me, no they don't. I said, yes they do. All you gotta do is show up in the emergency department, anywhere around the nation. The question is that the way we want healthcare to be provided to everybody on our watch? Do we want a certain segment of society who can't afford the front door to the American healthcare system, called coverage, to suffer longer than anyone else, and then go through the most expensive door for care when they get to a point where they can't take it anymore, and they go in for care? Or do we want to build a different kind of ecosystem that says, here's some basics that everybody in the American dream should have as a threshold of what we as a society stand for? One of the initiatives that we're doing in Kaiser Permanente is around homelessness and affordable housing. We're doing it in part because it's directly related to our health agenda. We would argue that for a person to be healthy and to aspire to good health, they cannot live on the streets of America as their home. There's an inconsistency. And the second reason we are working on homelessness is because we believe that that's a standard on our collective watch that we should not accept in communities around America. And we said in Kaiser Permanente, while we can't solve the world's problem, we can work with many others to solve the communities in which we exist. And the communities in which we exist, there are 66 million people living in those communities. And we have an interest to make sure not a single one of them are in a homeless situation. And that's part of our line of sight. I really enjoyed the question that came up about leadership. And I'll think about that some more even when I leave, because it was just a pointed question, and I enjoyed the dialogue from it and some of the things that we talked about it. I want to frame maybe a couple of thoughts, and then do I open it up for questions? Yeah, and then open it up for questions, and that's when you participate. And give you at least something, hopefully, to continue to think about as you start your journey, and you're on your journey, and you're going to learn a lot, you're going to impact a lot, and you're going to do a lot. There's no question about it. You and we run the risk that the problem could get worse. Because one of the groups that I belong to is the World Economic Forum, and we get together once a year in Switzerland and at what we call Davos. That's another place that I finally got to go to. Like, wow, it's cold here. There's a lot of snow, but a beautiful place where world leaders get together. And one of the things that we've been talking a lot about in Davos is the fourth industrial revolution. That we're in the midst of the fourth industrial revolution. And probably all of you, how many of you have heard of that? Oh, okay. So, if you think about the different revolutions that we've been under as the world, as society. So in the first industrial revolution, you had a lot of the changes going on from actually the invention of transportation, moving from camels and horses and all that to, in particular, railway and steam. And what you have from that was the beginning of the distribution of natural resources being transported and people that then started to aggregate into town settings and other settings. So you had a massive change in society as a result of the, if you will, the invention of modes of transportation like railways and steamways, etc., that moved our society to a different place. And a lot happened. Just a lot happened. You have the evolution of things that started to happen very differently when that happened. The second industrial revolution really fell along the lines of electricity. And you have from that a whole generation of new things happening as a result of that. How people aggregated, how distribution centers were now created, the use of power from electricity that do things very differently, that complemented people power. So you had that moving along. The third industrial revolution was around computing, the beginning of the use of technology. And then the fourth revolution, which is being debated now, the fourth industrial revolution, is a combination of digital and the Internet of Things and the ability to use sensors. And so you can now start to think about the impact of the fourth industrial revolution on our everyday life. Uber is a product of the fourth industrial revolution. is a business model that is built on the back of technology. And all the normal things that businesses were using up until now was turned upside down. So you had the ability to use technology that brought together a demand and supply. And Uber now transport more people, for example, than any cabs or whatever. And they basically don't own a car in their inventory. That's the reinvention of the business model in the fourth industrial revolution. Airbnb surpasses now any hotel chain. And inside of their inventory, you won't find the physical asset. The bed, whether that's the hotel, they use the platform of technology to create this new business. I think many of you and many of us read about Lyft that just went public. They don't even have a forecast for making money. But it's the genius of the technology and the fourth industrial revolution that is allowing them to turn upside down the business models of the past. The fact that we're learning how to take sensors and attach it to people is allowing us to think very differently about how we would provide healthcare in the 21st century. We're working on experiments now where we're censoring homes for our patients and members so they don't have to worry about coming into the environment for us to keep track with how they're doing with blood pressure and weight control and all the kinds of possibilities that we see as a result of the fourth industrial revolution. And then the fourth industrial revolution could potentially turn upside down the future of jobs. I had a group of people in my office a week and a half ago who invented this company that is flying drones in Rwanda to deliver blood supplies and prescriptions to the different places around Rwanda. The application of that technology has relevance in what we do with prescription medicines in the future. A lot of challenges, but a lot of opportunities. If we're not careful with the fourth industrial revolution, we'll end up again in a society where the people who can afford it will have it, and the people who can't will not. One of the challenges of the fourth industrial revolution already is some of the workers, the manual labor workers, are starting to feel what this technology means to their jobs and to their futures. Because many companies are creating the kind of technology with the digital capabilities to wipe out the need for manual labor. And then with the Internet of Things, the ability to connect the dots, and we all witness the Internet of Things every single day in our lives now. You have the opportunity to create different experiences. So now when you go on your system to buy a ticket, the Internet of Things may connect you with hotels, rent-a-cars, all the things that you would need to make your trip complete. So with all of that going on around us, why wouldn't we want to take those lessons and apply it to health and healthcare in the 21st century? That's the opportunity that you and we are going to have in this new world that we're all going into. And then the final thought that I would leave with you, and then we open up for questions. You got to keep me honest the time. is one of the areas that applies directly to Kaiser Permanente. And I'm very fortunate to work for just a tremendous organization that I've now committed 36 years to. And I tell people all the time, I've stayed with Kaiser Permanente for 36 years because I've been compelled and driven by his mission for 36 years. Believe it or not, it's not because I could not have gotten another job. And then I'm one of these rare cases of an individual who stayed with an organization that long and today is honored to serve as chairman and CEO. This year we probably do $82 billion in revenue, and we're honored to take care of 12.5 million people. Soon to be 13. I also told the organization that I only can promise you one thing, and that is we have to change. And I've crystallized our change agenda being driven by 4 forces now. We have 4 forces of change that we think about all the time. The first one is consumerism, because people are acting like consumers now, finally, for healthcare. Driven by several factors, the largest being people are paying more for healthcare directly. And so the incentive has changed versus just being covered to get the care. The second one is around our customers. They're asking very different questions, principally around affordability or the lack thereof. That's the second one. The third one is around competition. And the competitors of the past are no longer top of the agenda for organizations like mine and many others. If I was here 5 years ago and you said to me, who do you consider your competition? I would say, it's an organization like United and Humana and WellPoint and those things. You ask me today, who do you consider your competition? It's Amazon, it's Apple, it's United. It's a whole different now portfolio because of what has been happening with the technology. And then the fourth area is what I call our internal culture. Culture that was designed for a purpose then, is it still the relevant culture to drive the change agenda now? So, in that context, we took the organization through an incredible exercise over the last couple of years. And it was a re-examination of our mission that our forefathers put together. That basically said the dream of this organization is that we exist to provide the highest quality, in essence, necessary for a person to live the healthiest life possible and to make it affordable to the people who join us directly and to the communities in which we exist. And after that examination, we said, spot on, still relevant today as it was almost 75 years ago. But then we said, what else is needed for the 21st century? And we said, eventually, what else is needed in the 21st century if we know we're going to be in a major continuous change agenda? What we need to do is to affirm or reaffirm our beliefs. So when today 225,000 employees and 25,000 physicians might get confused in the maze of change, what we stand for, what we believe in. We need to declare it up front so they will always know what the true north is of Kaiser Permanente. So we did that. And I want to tell you what they are. Our beliefs. We believe that life, liberty, and the pursuit of happiness require total health. And that includes equal access to high quality health care for all. We believe that health care must be affordable for all because thriving individuals, families, and communities require that. We believe that total health is more than freedom from physical affliction. It's about mind, body, and spirit. And we believe in a healthy and engaged life with good beginnings and dignified endings. And so we said, we're going to be doing a lot of 21st century work on equality of care, equality of access, a total paradigm continuous shift to health as being the central piece. And as we do that, we're going to naturally create a level of disruption around us. And or we're going to be disruptive or disrupted. But what we will never deviate from is our value system and a set of beliefs that's our ultimate destination that we want to help to drive to. And those are our 4 beliefs. So I'll stop there. Thank you very much, and then open the floor for questions anywhere you want to take it.
Thanks. And I think if you have a question, oh, yes. Sorry, I moved to logistics before manners, but I got manners back, so thank you. If you have a question, please raise your hand, and we have folks with microphones that will be in the aisle. So,
Mr. Tyson, thank you so much for coming today and for speaking to us. I had the opportunity to hear your last presentation before a room full of primarily students who are focusing on leading organizations. And I think that your status as a leader of an organization that is nonprofit, but that is extremely successful financially, is an important one to bring to this room. And I appreciate you closing with the framing of your institution's values, because I think those values and beliefs are framed by information and facts. And it's important to know that those facts come from all of the disciplines in this room. We know that our epidemiologists and our behavioral health people and our environmental health people frame the realities of social determinants. But there's sometimes a disconnect between what happens at the organizational level with people who lead health institutions. So can you talk about how important financial motivations are? You talked about it on the consumption side, but can you talk about it on the delivery side, knowing that we won't see the type of transitions, the system level change that you're talking about, without fundamental changes to how we reimburse people, especially understanding that that's the primary motivation for people who enter healthcare. And thank you for your time.
Yeah, that's a great question. It's a centerpiece of debates that I have with the industry, with the government, and with others, and that is around 2 things: the financial infrastructure of healthcare, that is by and large still a fee-for-service model, and then what I call the misalignment of incentives around that, right? So we had this discussion last night at dinner, and I think earlier today as well. My model is basically a capitation model. It's a model in which I get the whole dollar to take care of a person and all the risk associated with it. But it's also a model where I bring all the stakeholders together and we decide the best use of that dollar. All right? Now, the reason why that's important is because the line of sight is on the whole. The healthcare industry is siloed. And so the way the healthcare industry works is two things. One, you don't get the dollar ahead of time to plan a delivery system to then take care of the population. You get paid every time you do a procedure. And so what does that lead to? It leads to do more procedures, get more money. And so it's a volume-driven system. And I've said many times, it doesn't mean that we're more ethical than potentially someone in that kind of a system. It just simply means the incentive drives a different behavior. And somebody asked a great question last night on my side of the equation, saying, and what's the incentive to make sure that you aren't withholding care from people who need the care? And I said the freedom that they could walk to the place across the street and get care, right? And so we don't hold you hostage and hold you privileged. And we have all the indicators to show that our results are actually better than what you're getting on the outside. And now that we're getting more sophisticated in healthcare to use third-party information, we're actually getting that validated by outside sources, so you have the credibility at a much higher level. There's a reason why members stay with us longer than any of my competitors, actually any other in the industry, because of their relationship in the aggregate with Kaiser Permanente. The second thing is, we have demonstrated with the technology and with the sophistication of drugs and therapeutics and medicine and the science of medicine now, a couple of things. One, healthcare plays an important but small role in the overall health and well-being of the individual. And so the issue of the social determinants of health plays a critical role as part of Kaiser Permanente's agenda, because we've discovered the direct effects of the social aspect to the health care. And because we accept the total risk, it's in our interest to go upstream and figure out how to work with communities around crime prevention and violence, and how to work on homelessness, and how to work on some of our communities of color lacks the infrastructure of grocery stores. And we know healthy eating is a critical part of good health. And so we have farmers markets around the country, predominantly in our lower income communities, that gives them an opportunity to begin to use fresh fruit and vegetables and things like that. And then we have classes and computerized classes, etc., to help educate the population on proper cooking techniques and those kinds of things. So it's all part of the whole ecosystem of health, as we call it in Kaiser Permanente, as opposed to the siloed approach that I'll go until something happens to my body and then I come to you to fix me. The economics has to change, so you create those incentives to do the right thing. Now, in my case, I happen to believe strongly in the not-for-profit model because I'm not beholden to make profits to give to my shareholders. I don't spend time working on the bottom line. I don't spend time working on the bottom line. Someone asked me, well, how important is the bottom line? And I said, it's like air to me. It's air. I need it to breathe, right? But I don't wake up every day thinking about my whole life is centered around, am I going to breathe? Now, if I run out of air, breathing is pretty hard. And so to the management team inside the organization, we set a very aggressive target for income, 2%. We said that's the minimum we need to generate the cash to put back into the capital program, to be able to borrow money from the market, and to have cash available. We need 2%. Now, it just so happened on an $80-something billion company, 2% is a lot of money. And so it replenishes the organization. I don't have, quote, shareholders who would naturally be incented to say that 2% should be 10%. And then my energy is spent on the 10%. So when you ask me the differences between what I do every day and what potentially some of my colleagues are doing, my line of sight is the member and the community. Somebody else's line of sight is the member and the community. They would argue also, but they would say my line of sight is my shareholder. And even though I may not be thinking about them every day, you better believe once a quarter I am, because that's when I have to give my report. And once a quarter I have to give my report also, but it's in the context of affordability as opposed to profitability. And for me, that's the big difference in the incentive. Oh, sorry.
Oh, you didn't? Oh, sorry. Hi, thanks. First of all, one of the things that is, in my mind, a cornerstone of Kaiser is its commitment to evidence-based care. And that's really, really important. And I think if you put that together with the fourth industrial revolution, it raises, in my mind, the issue of ethics. And, I think Kaiser can be and should be an important voice at the table for determining when a new technology is actually ready for prime time.
Yeah.
And so I'm just interested in your thoughts about that. And the other around, quotes, ethics is, and I'm going to be cynical for a moment, some of the partnerships with Amazon and Apple I see as more public relations than public good. So anyway, two things to hear your thoughts on.
Yeah, I appreciate both those perspectives. One of the pleasures that I have of working inside of Kaiser Permanente is along the lines that you're raising, which is the ethics. We have seen it I have seen it in the personal history of my time at Kaiser Permanente. It shows up, and I mentioned one of these examples this morning, that we were in the forefront of doing two things when Gilead got the new drug, Sovaltus, which was really, for me, a game changer. It was exciting because it was now the possibility in our generation that we were actually talking about curing something as opposed to managing a chronic disease. So it was exciting. The challenge was the price that it attached to it. And when we first started to talk about this, you couldn't get a return call. And it was, this is the price and this is it. Because we have the electronic health record and the longitudinal data of all of our members, we pretty much, the day we discovered this, we pretty much were able to push the button and we knew exactly how many of our patients were going to benefit from this new drug. And it was in the thousands. In the thousands. And one of our doctors in a meeting said, we have all of our patients, they're going to need this drug. We need to figure out how to get them this drug. And the concern is it's going to bankrupt the company. And I said in that meeting, your job as the doctor is to do exactly what you know what to do, which you're saying is, in essence, do the right thing for the patients who need it. I know you're going to do the right things. And then we will work on the other side, which is how to deal with the economics of this, because this is a bigger issue than Kaiser Permanente. This is a healthcare industry issue. So every single patient who belonged to Kaiser Permanente got what was needed. And proud of it. And it's beautiful. At the same time, we began to advocate to the government and others that Houston, we have a problem coming. Because if there are no boundaries for what can be charged for this inside of an ecosystem of health and affordability for the American people, then it will not be long before a $100,000 drug becomes $1 million drug. And all of a sudden now, the question is going to be, who's going to fund and pay for a 30-day drug treatment that costs $1 million for a population? We've always had very expensive drugs, but they were targeted to small populations based on unique illnesses. Now we're talking about drugs and discovery in which is applicable to large populations. But to your point, the ethics drove the decisions. We have examples of our medical group taking controversial positions because the evidence did not demonstrate the outcomes and the results. And won out over time that was the right way to go and the right path to take. So those are balancing acts that we constantly have to think about and have to work through. And I would argue is one of the most important things to have, and it is why, in large part, what keeps our members so long with Kaiser Permanente is the most precious asset we have, which is trust. And our members trust that we are doing things in their best interests. And when we violate that trust, we're willing as an organization to acknowledge the mistake. And what we have discovered over the years is that people are forgiving when they really believe you're trying to do something in their best interests. And by and large, across our population, in every one of our markets, that's how people view our organization. And that's what we work very hard in, based on the whole concept of evidence-based. Now, that being said, what we're also willing now to acknowledge to a certain degree is that to quantify the benefits of the social determinant debate, we acknowledge that we're in discovery, that we are in fact working towards the measurements to quantify the efficacy of the resources allocated there to the direct impact on health. And that is very different from our organization because we have always used the concept of evidence-based medicine to say, and this is the discovery that we already know, and we're testing the future of something against what we already know. This is pretty much saying we have a theory that's grounded in great things that we know, but we haven't proven it because we don't see any evidence of it really across the spectrum to say, and now we can compare against that. But even that we're doing in an evidence-based way because we'll have research attached to everything that we're doing when we talk about the homelessness and climate change and gun prevention, etc., to quantify it over time for generations to come. We do share that belief that not all relationships is really public good, but some of it is. And some of it is, in some cases, sizzle without the steak. See, I'm still thinking about that porterhouse steak. Without the steak. And in other cases, there's steak there. There's real meat there. And we see that a lot. We see a lot of wonderful examples of the use of AI. And then when you dig in it, there's little to no substance underneath it. And so it really is based on the possibilities as opposed to the realities. And that is in its phase now, and we'll see what happens as it goes along.
I think we can maybe take one more question.
The benefits to the community of providing healthcare tend to unfold over time, and they tend to be sort of dispersed along networks. But as you pointed out, our payments tend to be very immediate, fee for service. And when we measure outcomes, we don't look at how the measurements spread out from that individual, how the boss benefits, the teacher benefits. We generally focus our outcomes, our measures, on just the health of the individual. So do you think with this new fourth industry that we're supposedly getting of modeling and of networks and information, that there's some way to actually make explicit those inputs in network and start to pay people and measure outcomes in a more communal way.
Yeah, and actually, thank you for that. What a great framework and course to end on, because that's actually part of the work that we're doing. We actually are creating. I think I've mentioned to many of you. I have a chief community health officer who works for me and Kaiser Permanente and on my top leadership team. And we have the 1366 strategy. Now I'm going to 33 million members, where we have almost 13 million members, and we exist in communities of almost 60 or 66 million individuals. His job is to sit on my team and represent the 66 million. And one of the things that we're working on is community level health assessments, the health of the community. And there are other organizations, by the way, that's doing the same work. And it's right to your point. It's not just looking at the person, the direct benefactor, but also the environment of people around it. And that gets to the whole social infrastructure and everything. And we're looking at it around mental health, social well-being, and physical health. And then we're looking at the health factors of those communities in our health assessments that we're doing now every 2 years, that really in the aggregate look at both the state of the health of those communities, and we're going to actually give scores to that, and what are the health challenges of those communities that we should focus on with the communities. And that begins that expansion to what you're describing. The reason we can do it in our model is because of the financing mechanisms and the incentives. And if you are, for example, a centerpiece of a hospital and your financing is revenue for heads in the bed, you have a hard time of, as much as you might want, you have a hard time of the redistribution of those resources into that kind of a concept when it's really concentrated towards defending revenue for patients being in your hospital beds. And that's part of the challenge we're going to have with redesigning our health system in this country.
Can you please join me in
Thank you.